All right, so I guess we'll go ahead and get started. So, my name is Autumn Sipus. I'm the Marketing and Outreach Coordinator with the Canadian Coalition for Green Healthcare. Before we start today, I just want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation. And myself, my executive director, and our panelists will be answering those questions at the end of our webinar today. We will also be recording this webinar, which will be sent to all of our registrants and will be available on our website at a later time. So I will now hand things off to the Coalition's Executive Director, Neil Ritchie, to begin the presentation.
Well, thanks very much, Autumn. I'm Neil Ritchie, the Executive Director of the Canadian Coalition for Green Healthcare. I'm delighted you could all join us today. I'm joining you actually from Halifax. We're preparing for a hurricane here, so I'm glad that this session is today and not tomorrow, because we might not actually have an internet. The Green Hospital Scorecard program has been going on for over 8 years. It wouldn't be possible without the support of our sponsor, Save on Energy. So thank you very much for that support, but it also, of course, wouldn't be possible without the participation of over 100 hospital sites. So thank you to all the hospitals that participate in the program. We are hoping to expand the program to long-term care next year, and also to update our technology platform. So we see this as an expanding program. It's particularly important since COP26, Canada made a commitment to a resilient healthcare system that is net zero. And so we see this as an important program that's growing across the country. Today's agenda includes an introduction to the Green Hospital Scorecard timeline and an overview. And then we'll do presentations to the presentation to the winners and to honorable mentions. And then really pleased to have Terry Maslin, who's the facilities director at St. Joseph's Healthcare Centre in London, to present from their perspective. And then also Emily Hung, the energy project manager for Unity Health, will tell us a little bit of their story. And then Autumn is going to present some information from Fraser Health. So we're looking forward to that. We'll have then hopefully a opportunity for some questions and answers at the end. So the Green Hospital Scorecard program has been going on for some time, but of course, because of the pandemic, this past year, we had to actually combine 2 years, 2019 and 2020, in our data call last fall. And so those scorecards were distributed, and the results over the summer, and now we are at a stage of ready to present some awards. And then in the fall, we will be providing a full report on the results from the scorecard program, and then also a data call for 2021 calendar year. We're committed to continuing the program for next year, and so stay tuned for announcements about when the next data call might be coming. Yeah, so the participants get a scorecard that highlights their energy use, waste management, water management, policy and planning around pollution prevention, but not all of the categories that we collect data from in the survey are part of the scoring. So there's actually 10 sections on the survey. Only 5 are weighted towards the final score. Those are in energy that we're going to talk about today is actually the largest percentage at 40% of the scoring. And then leadership at 20%, policy and planning around pollution prevention 10%, and waste and water management at 15% each. Yeah, other categories include food, transportation, anesthetic gases. Okay, I just wanted to say that our, oh, I guess I'm going to turn things back to Autumn to talk about our results, but I was going to say that our awards recognize both the top performers and the honorable mentions that we'll talk about later on. But Autumn, if you just want to give us an overview of the results that we've gotten so far, then we'll go into the awards, and then we'll have presentations from the other hospitals. So over to you.
Sounds great. Thank you, Neil. Hi again, everyone. So I'm just going to quickly go through some of our averages from this year's data from the scorecard. I'm going to start with our participation this year. And just quick reminder, as we're going through these graphs, I'm going to show you guys that so our 2021 scorecard, this past scorecard, we took into account data from 2019 and 2020. The graphs only show the 2020 data because there wasn't enough data from 2019 to be significant enough to create graphs and averages. And so when you see on the screen, you'll see 2021 scorecard and you'll see 2019 scorecard, which is comparing this past scorecard's data to the 2018 data. Okay, so in terms of participants, our participation is up from previous years. The 2019 Green Hospital Scorecard had only 83 participants, mainly due to the start of the COVID-19 pandemic. But something that is consistent with previous years is that academic is still our largest group, and small is obviously still our smallest group. But we did have 99 participants this year, which was really great, and it's back up to what it was pre-COVID. This is just another graph kind of showing our yearly participant comparisons. And as you can see, we've seen a steady increase in participation from academic hospitals and a decrease in participation from community. Not sure why that is, but it is interesting. Okay, so this chart shows the total amount of energy usage in each category. So electricity, natural gas, propane, fuel and oil, etc. So consistent with 2019 Green Hospital Scorecard, we see there is a high natural gas usage and a high electricity usage, but surprisingly, natural gas is actually higher than electricity. Despite electricity being one of the primary sources of energy, we use it all the time, every day. But it is really nice to see that there's a distribution of energy usage over the other categories, which shows that hospitals are continuing to diversify their energy sources. So energy use intensity, we look at the gigajoules used per square meter over the past 5 years for each of the peer groups. So there's been a slight decrease for each group, aside from the non-acute, which has seen a slight increase in energy use intensity. So it's really great to see that, each site has either gone down, stayed the same, or has only slightly increased in their energy use intensity. But it is really great to see that community had a large decrease in their energy use intensity. Yeah. Okay, so energy use energy behavior. So we've introduced energy behavior into the survey, and we do ask participants what their understanding is of energy behavior. And I think it's important to have an easily available or easily understandable definition available. So energy behavior is the engagement of individuals or groups in minimizing the use of energy produced via the consumption of fossil fuels, while supporting the transition to more sustainable energy development through their thoughts and actions at work and at home. So the first question was, does your facility have an energy behavior initiatives? It's really great to see that more people did say yes than no. Obviously, a lot didn't answer the question, but still, we did have a significant amount of people that do have energy behavior initiatives, which is great. And another important aspect to look at is, how did the energy managers of facilities learn about energy behavior? You can see the sources vary quite a bit, with most people getting their information from websites and webinars. But it is nice to see that energy behavior is becoming a topic of conversation, and that more energy managers are choosing to participate in workshops and training to learn more about it. And now I'm going to hand things off to Neil to go through the energy awards.
Okay, thanks, Autumn. One of the great advantages of the scorecard is that we segment the data according to 4 peer groups. So community, academic, non-acute, and small hospitals are their current groups. We're hoping to include long-term care in future. So in terms of our energy awards, congratulations, first of all, to the honorable mentions category. And we have Markham Stouffville from the community group, University Health Network, Toronto Rehab Centre in the academic, and St. Joe's in London for the non-acute, and Strathroy Middlesex General Hospital for the small hospital group. And the winners this year for the Energy Award for community, it's Northumberland Hills Hospital, academic, Providence Healthcare, and non-acute, St. Joseph's Healthcare, Parkwood Institute Mental Health Care Building, and for the small hospital group, the 4 Counties Health Services. So congratulations to those winners too. Yeah. Good.
And so we had the energy awards for Ontario, and then we also did energy awards for Canada wide, because
sorry.
Yeah, no problem. So in the past, we've only done Ontario awards because of our sponsor, the IESO. But now going forward, we're going to be having a different funder for the Green Hospital Scorecard. So in the future, we're going to be honoring Canada-wide, not just Ontario. So we wanted to do this year and have 2 different categories. So you guys could see we had our Ontario winners as well as our winners for the rest of Canada. And so we had a really great participation from the BC sites, which was great. So we did have our honorable mentions for Energy Canada-wide, which was the University Hospital of Northern BC and Vancouver Coastal Health. And then the winners were Fraser Health, the Langley Memorial Hospital, and Providence Healthcare St. Paul's Hospital in BC.
In terms of energy behavior, we have congratulations to the London Health Sciences Centre, who is the winner in that category. And the winner for energy behavior is St. Joseph's Healthcare in London. So congratulations to you for that. Okay, I think we're now ready to move to some presentations from the top performers.
Okay, so now we're gonna go ahead and give Terry the floor. And
Okay, thank you for allowing me to speak today. My apologies for not having a more formal presentation, but as you can imagine, things have been a little bit hectic since in the past couple of weeks. So very happy to have received the two awards today. The efforts and investments that we've made here at St. Joseph's with regards to energy savings have been fairly significant and fairly painless to our hospital operations. In the past few years, and this year in particular, we have done an extensive rehash of our lighting systems to LEDs. We've looked at independent water heating systems, made substantial investments in those, which are saving us a vast amount of energy. We've also installed VFDs on most of our HVAC units in our main hospital. And what we're finding in that particular globally, corporately wide, is those have reduced our consumption by huge amounts. And the ironic thing is that the costs for our utilities and energy have been holding firm. So we haven't seen financial savings, mostly because of the impacts of the carbon tax on our utility bills. So I just shudder to think, if we hadn't made these investments, what our costs would be going forward. So we're very happy from a corporation perspective that our investments are in fact paying off as far as consumption goes. For the building acute care facility, our Parkwood Institute Mental Health Care building, which is located just south of Commissioners and Wellington. It's a fairly new building. It was built in 2014 as a purpose-built 3-section facility, which is more or less, more or less sort of a microcosm of a community. So it's got a downtown area, it's got a neighborhood area, and it's got what we call the houses. And we have approximately 175 patient beds in that facility, and it's specialized mental health care from dementia and geriatric programs to dual diagnosis and severe mental health issues. So it's a brand new building. It is LEED Gold certified. It costs about $350 million to construct. It is fully and 100% redundancy with regards to generator. And it has already saved us approximately annually up to $400,000 a year in electricity, just that site alone. Plus, where our electricity use has gone down by about 2.2 million kilowatt hours, and our steam use has gone down by approximately 16 million pounds. And our green gas emissions are reduced somewhere around 1.2 million kilograms. So we're very pleased with the way this building is performing. It's our landmark facility with regards to state-of-the-art technology, and they just happened to also deliver great patient care. So we're very pleased with that. So again, thank you very much for letting me speak here today. And if there are any questions after the program is done, I'll be staying on till the end of the call. And everyone has my contact information, so feel free to reach out to me at any time if there's any questions or if you want any more history about our facilities. Thank you.
thank you, Terry. We're now going to hand things off to Emily, who will share her screen and give us a little presentation.
Oh, Hello, everyone. My name is Emily Huang. I am with the Unity Health Toronto as an energy project manager. Today, just want to share a little bit our energy work at our health network, and in particular at Providence Healthcare. So Providence Healthcare is one of the three main campuses within our health organization. It is located in Scarborough near Warden Station, for those of who know about Toronto. And it's actually one of our newer facility of our portfolios. So the facility consists of a hospital side, which is around these wings, and they were built in the late 1960s. And the long-term care facility is at the back of the facility, and they were built around in the late 1990s. So one of the challenges that we're having is with older facilities, before we implement any energy efficiency measures, there might be a requirement to upgrade our infrastructure, which adds a bit of cost to any of the projects we wanna proceed. So. Here we have, so I have joined the organization in about 2019, actually with the help of the IESO's Energy Manager program. So since I joined the organization, our team has grown to 3 full-time staff, and we are making continuous improvement and building a comprehensive energy program. So here we're kind of breaking down into 4 sections that we have in this program. So in the annual programs, we conduct steam traps, we apply for sewer rebates. One of the actually big impact we're making for the organization is that we are budgeting for the utilities and tracking, and so really linking our performance to the finance side of things. And of course, we are helping with procurement of the natural gas for the organization. On a monthly basis, we actively track our utility consumptions, not just looking at the consumption itself, but also looking for billing errors. For example, recently we have identified billing errors on our steam bills and retrieved about $250,000 just for that utility. So really helping us to further building our team. And after we analyze the data, we arrange monthly energy meetings and report back to the managers, to the operational managers. So on the reporting side, it's very important for us to do external reporting to hold ourselves accountable. So as all other public sectors in Ontario, we report to the border public sector. We're participating in the Green Hospital Scorecard. We also report back to the IESO and Enbridge on their energy manager programs. So after all this work, of course, we want to make the real changes through implementing energy projects. So we actively looking for opportunities, making business case, get the funding approved, and implement the projects. At the same time, we're really leveraging the incentive programs and rebates, and to reduce the payback time and achieve the consumption savings. So kind of summarizing from, since our energy team was officially formed in 2019, we are seeing a reduction of 1% of energy use at Providence, which was actually already a pretty efficient building to begin with. The low-hanging fruits we have captured quite a bit, mostly in the lighting retrofit. We mostly just did the lamp replacement because it was really cost effective, and that really helped us to do a lot of them. We actually replaced all our lamps in the common areas, so the hallways, the staircases, to LEDs, and makes a huge impact on the electricity bills. And one of the things that we did, we're really proud of, was that our facility operators, they used to just order the CFL lamps in their daily replacement and maintenance work. And we basically help them to find new products, the LED products. And now they started to only order the LED versions that we help them to identify. So that really helped, made a big change on not just implementing projects, but an impact on the daily operations. We also tag along to the infrastructure renewal programs, because as we know that there are certain larger projects, they don't necessarily have a short time period of payback. So my counterpart actually take lead in many of the steam or the heating side of the work, HVAC work that we're helping with, for example, the domestic hot water tankless system, as a part of the infrastructure renewal projects. So last but not least, one of the engagement work we're doing is hosting monthly energy meetings with the facility leaders there. So in this meeting, we update the utility metrics from the monthly programs. We also discuss the progress on the current projects we are managing. But most importantly, we position ourselves as internal consultants. We meet with a manager there and discuss about the pain points or any of the concerns they have in their facilities that our team can help. So this really helps us to build that relationship and also getting more new ideas that we don't even need to try to sell. We just we're there to help. So the feasibility of those projects are usually easier just because there was a need for them. So we actually have already captured most of the low-hanging fruits in this facility. So right now we are kind of slowly shifting to a more higher level work. We have started to we have already completed a ISO 50001 gap assessment. And with the take back from that assessment, we are getting ourselves to be ISO 50001 ready. Another item where we're shifting our efforts on is to create a building construction guidelines focused on energy efficiency. We have seen some new development or new retrofit projects that we feel that energy efficiency could be better. So we're trying to put in that lens to any of the future new development. And again, so improving, one thing is that we're looking at how we improve our efficiency, but at the same time, we want to looking at the low carbon alternatives or strategies for future development as well. So that will come to the low carbon alternatives, for example, for HVAC system, or how we can build our building envelope to be more kind of a low carbon route. There's no way we can do this work by ourselves. As an energy manager, I know that we heavily rely on the support from the other parts within our organization. So we have within the hospital, we have Environmental Sustainability Advisory Committee, and we have the executive sponsor, which is CFO of the organization, who is really helping to advocate for sustainability. He actually himself led a campaign called Sustainability Campaign that addressing some of the energy issues. For example, we did a turn off your computer campaign that urged the staff to turn off their computer at nighttime, and the CFO has taken the leadership to advocate for that campaign. We also care about the waste and recycling, although that's not really considered as the on-site GHG emissions inventory, but we have created a training module that available for the organization, for every staff within the organization to take. So that is all my presentation. Give it back to Autumn.
All right, thank you, Emily. Great presentation, and thank you again, Terry. And I'm just going to be doing a brief presentation on behalf of Fraser Health. Unfortunately, they couldn't join us today, but I thought it was important that we had some representation on the West Coast, because we're very grateful that this is increasingly becoming a Canada-wide program. It used to be mostly just in Ontario, so we're happy to see it expanding and more sites from outside Ontario participating. So Fraser Health Langley Memorial Hospital won our award this year for energy Canada-wide. They really excelled with their energy use intensity scores. And something else interesting from their scorecard was that they implemented new technologies for energy efficiency and conservation, including heat recovery chiller with heat recovery coil to preheat hot deck air handling units and domestic hot water. And I thought this really reduced the load on their boilers. And so Fraser Health Authority as a whole has a goal to reduce their carbon footprint by increasing energy efficiency and reducing reliance on fossil fuels. Fraser Health is continually looking for opportunities to reduce the amount of and intensity of energy and water use and greenhouse gas emissions from healthcare operations. Energy efficiency measures and water conserving infrastructure achieves greater output using fewer resources, thereby lowering their environmental footprint without compromising patient care or employee comfort. So they have a 2030 target to reduce energy use intensity by 25%, and their 2020 target was to reduce their UI by 15%, which they almost accomplished. They ended up reducing their energy use intensity of core sites by 13.5% in 2020. So they have an energy management program which seeks to reduce reliance on fossil fuels and overall energy consumption, thereby reducing the negative environmental impacts and supporting human health. The program develops strategic partnerships and strong relationships with a wide range of stakeholders, particularly maintenance and operational teams, projects and planning teams, consultants and utility providers, to identify and implement energy conservation opportunities. The program also undertakes measurement and reporting on key energy performance indicators and benchmarks. It connects with internal sustainability consultants on systemic and behavioral change initiatives and monitors and tracks project funding. So their energy reduction strategy involves things you see on the screen. So energy studies to determine project opportunities, heating plant upgrades and district energy solutions, efficient lighting upgrades, control system optimization, cooling plant site strategies, heat recovery retrofits and installations, behavioral change campaigns for energy conservation, and building for energy and environmental sustainability. So this includes achieving LEED accreditation, the globally recognized green building rating system administered by the Canadian Green Building Council. So they also have an energy and environmental sustainability team, which was created in 2010 to ensure that a collaborative environmental and sustainability approach was taken to the Lower Mainland health organizations, which includes Fraser Health, Providence Healthcare, the Provincial Health Services Authority, and Vancouver Coastal Health. Since then, they've partnered with many departments, teams, and individuals to integrate and enhance sustainability infrastructure and practices in a variety of projects and programs, and made health and wellness central to their work. This team is really driving to the push for environmentally sustainable and resilient healthcare. They also founded and led the Green Care Network that unites efforts within all of the BC healthcare community to transform their health system towards environmentally sustainable and resilient care, primarily through connecting diverse groups across the Lower Mainland. And Green Care just amplifies and celebrates programs, projects, and staff that is actively working to address the climate reality. So if you want to learn more or reach out to Fraser Health, you can visit their website, and you can also subscribe to their newsletter, which links are available on their website as well. And now if anybody has any questions for myself, for Neil, for either of our presenters, Emily or Terry, you can put them in the Q&A now and we will answer them. And if Neil has any words he would like to share right now, you're welcome to do that as well.
Sure, of course. Thanks, Autumn and Emily and Terry, for those great presentations. They're really interesting. There's a lot of really good things going on across the country. Energy management, of course, is the biggest way we can reduce our greenhouse gas emissions. And so this is probably the most important category. It's an area that hospitals have been working on for a number of years, but of course technology is changing, and we are able to take advantage of different kinds of technologies and programs that are out there. I think I did also wanted to add my congratulations again to the winners, but all the participants in this program really are winners. It's actually a lot of work, I know, to complete the surveys, but it's just once a year, and we are hoping that it's continuing to be relevant. This year we did include sections for feedback on the scorecard. So if you do have any further suggestions, we'll be analyzing those results as well and trying to incorporate them. But if you have any thoughts about how we can improve the scorecard, by all means, let us know. And we'd be happy to try to integrate those into the new program. So I guess Autumn, would any other?
Doesn't seem like there's any questions from the chat, but if anyone does need any further information or has questions after this, you can reach out to me at autumn@greenhealthcare.ca. So if you wanted to get in touch with Emily or Terry about the activities that are ongoing at their sites, reach out to me and I'll put you in contact with them as well. And yeah, thank you everyone for being here today. We appreciate your attendance, and thank you again to all of our presenters. And we look forward to giving you all updates about when our next scorecard survey will become available.
Thanks a lot.
Take care, folks.
Take care.